Kettering Health Network needed to figure out the size of the ICD-10 project. Was it small? How big was it? What were we going to need? Who were we going to need to make this project a success?
The relationship went from being a vendor to a partner from the very beginning. I think we just felt the comfort level, and everyone who was involved in the steering committee, that when we first met with Beacon just felt like that was the right relationship.
When I first started there in early 2012, ICD-10 was but a glimmer in Kettering's eye. They really hadn't done a lot of work in terms of developing project structures. So what we did was we came in, we heard what the executive sponsor wanted to do, we began to develop those governance structures, we began to put a steering committee in place, and we began to educate the executives around the work effort that would need to take place to actually truly be ready for ICD-10.
Beacon was even integral at the very beginning of the project in defining a budget and staffing needs for this particular project and identifying what we'd need to be a success. One of the biggest things that I was able to do with our Beacon Partners project manager that I've never done with anybody else was bounce ideas off them, and she was able to challenge me if those ideas weren't in line with what she thought was best for the project. And there was this healthy conversation, this dialogue, because she knew our project, she knew our people so well that I could say, okay, I'm bouncing this off you, what do you think?
Our project manager has really become a part of our family and has become just instrumental and very well received, and has helped us move along this path over the last couple of years.
We have our systems inventory, we've done our training RFI, we have our training vendor. We currently have about 4,500 people loaded into the systems, about from the 7,000 that we think that are going to need training. The network wanted to do something to remediate the productivity for coding. There's a computer-assisted coding system in place now that's being utilized. All the groundwork has been laid for the ICD-10 readiness. Are there still challenges? Is there still work to be done? Yes, but I think it's, Kettering's going to be prepared.
If you ask me today, are we ready? Not quite, but I think we're almost there, and certainly we couldn't have done it without our relationship with Beacon.
We have so many areas of the project so successful now. Our training initiative, the way that we're rolling classes out, that we're following up on completion rate, has been handed over to somebody at Kettering Health to run. And it's been fun watching Beacon do that.